You see issues with self-medication in teenagers with ADHD, maybe undiagnosed, or can you just talk a little bit about that issue?
Yeah, the issue of substance abuse. It's interesting because if you take a kid who's been diagnosed with ADHD, they have a slightly higher risk of engaging in substance abuse. But if you look at the kids who have been treated appropriately, whether it's with stimulants or behavioral therapy over time, their risk goes down compared to that group of untreated children. That said, the stimulants, the medications that are used for ADHD can easily be abused. In most of our practices, we find the abuse taking place in the high school and college years, oftentimes among the kids who haven't been diagnosed. And they're either borrowing, buying, or stealing medication from the kids that have been diagnosed.
Because they want to know if it will help them with their schoolwork, or they want to experiment, or...
Sometimes it's to just as a study aid and to help with their schoolwork, and sometimes it's for some behavioral or emotional effect of the medication.
Mm-hmm. So that's something you have to be quite mindful of as well. Do you see a lot of alcohol use in kids with ADHD?
There tends, again, if you look at the kids that are untreated, they're a little more likely to try alcohol, tobacco, marijuana.
So it's all the substances.
Yeah.
There's no really one.
Yeah, and some of that we think is connected to the self-esteem issues that would develop over time, and some of it to the impulsivity that's there in these kids, and some to the social difficulties that they're going to gravitate towards a social group that they feel accepted within, and a lot of times that tends to be one that's experimenting with these kind of things.